Hello everyone, welcome to GrowMed. So in this video we will look at some important images from the dermatology. Okay, so I have covered those images which were asked in the previous year in the Fmge. Okay, so if you're new to my channel, if you're new to GrowMed, then subscribe to GrowMed, tap the bell icon so that whenever I post a video you will be notified. ओके सो वीडियो स्टार्ट करने से पहले लेट्स लुक एट सम पॉइंट्स कि डर्मेटोलॉजी में ना 5 या फिर 6 क्वेश्चंस पूछे जाते हैं हर साल. ओके, अप्रॉक्सीमेटली 7 और 8 क्वेश्चंस एंड मोस्ट ऑफ देम आर इमेज बेस्ड क्वेश्चन. अगर 5 क्वेश्चंस पूछ रहे हैं तो आउट ऑफ देम 3 और 4 विल बी इमेज एंड 1 और 2 विल बी वन लाइनर या फिर केस बेस. सो डर्मेटोलॉजी में इफ़ यू नो द ऑल ऑफ द इमेजेस वेरी प्रॉपरली देन इट इज़ वेरी easy to score. Okay, so before starting, I have also uploaded the videos. I have already uploaded the videos of the dermatology important one-line questions and the important topics which you must know for the Fmge. So you can go and watch those on my YouTube. The link is in the description box, so you can find those videos there also. Okay, so let's start the first question. As you can see here in the first question, there is dermatomal involvement of the skin. The rashes, they are present in a dermatomal manner. Okay, so this kind of infection is seen with the herpes. So whenever there is dermatomal involvement given in the question, just mark the answer as herpes infection. So it is a piece of a cake. If a clinical case is also described, then with the help of this dermatomal involvement you will be easily able to solve it. So moving on to the next image. The next image is that of a chickenpox or the varicella zoster. Okay, so in this image you can see the morphology of the blisters. The morphology of the rash is varying. Okay, you can see the ulcer also, then the papules also, and blister also. So such kind of presentation is seen with chickenpox. Moving on to the next question. The next question, as you can see here in the leg, there is some ulcers involved in a parallel fashion. Okay, and this kind of feature is seen with the sporothrix, and there is cutaneous involvement and lymph nodes are involved in this. A very important image because questions have asked on this image in relation with the micro also. Okay, then moving on to the next question. In the next image you can see here the capillary hemangioma. Okay, it is a benign tumor involving the eyelid, as you can see here, and this image was given in the recently Jan 2023 exam. Just the image and ask you to make the diagnosis. So it was capillary hemangioma. Then the next image. In this image you can see target lesions. If you appreciate the lesion, it looks like a target, and this kind of lesion is seen in erythema multiforme. Also a very important image and a very important topic. So let's see the next image. The next image, as you can observe here, in the lip area, these are honey colored crystals. Honey color crusts, and these are suggestive of impetigo. And impetigo, the most common cause is the staph aureus, and the most common location is the face, especially the lips, and this is most commonly seen in the children. Okay, तो एक child की image दे देंगे and this honey crusts and ask you to make the diagnosis. So it will be impetigo, a very easy and very straightforward question. Then the next question, this mycetoma or the mathura foot. This image was asked in the 2021 exam. So this image can be asked in relation with the micro also. So let's see its causative organism. So it is caused by mycetomatis, and you can appreciate that the foot is swollen and there are multiple sinuses and there is redness and there will be discharge coming from these sinuses. And if the same condition is caused by bacteria, then it will be called as eumycetoma. Okay, a very important image. Then moving on to the next image. So pyabaldism, as you can appreciate here in this image, that in the forehead there is triangular hypopigmentation and the hair are also white. So this condition is called as pyabaldism. Then the next question, molluscum contagiosum, also a very important image as well as an important topic. So molluscum contagiosum, it is usually caused by pox virus, and you can appreciate here the rash caused by this, as you can appreciate here, it is clear and there will be central dimpling kind of thing present in this. Okay, a very important question asked in relation with the micro also. Then the next image. In this image is called as Beck's lesion. As you can see here, there are a tuft of hair present and a hypopigmentation here. Okay, so this condition is called as Beck's lesion, and usually The most common location is the scapular location. Then the next image, this image is of a wood lamp. Okay, on the wood lamp you can see here red coral red color, which is also called as erythema, and this is caused by Corynebacterium minutissimum. So questions are asked on this Corynebacterium causes which kind of color on the wood lamp, or erythema, or questions are asked erythema is caused by which of the following. Okay, then moving on, let's see some other important images. The first image, as you can appreciate here, the subungual hyperkeratosis. Under the nail there will be hyperkeratosis occurring. Then this silver scaly lesion, so silvery white scaly lesion, and then the oil drop sign. As you can see here, the oil drop sign seen on the nail, and this one the auspicious sign. As you can see here, there is pinpoint bleeding present. When we pull the rash, we can see this finding auspicious sign. Okay, so all these features are seen in the psoriasis. Psoriasis also very important topic from the dermatology point of view. Every year questions are asked on the psoriasis, either the image based questions or the case, and whenever they describe this thing, silvery white scaly lesion, in the question, you should be sure that they are asking about psoriasis. And if psoriasis, along with psoriasis, points are mentioned like involvement of the skin, arthritis, and the nail. If these three findings are also given, then it will be psoriatic arthritis. And this psoriatic arthritis was asked as a case in the recent July 2023 exam. Okay. And this image, as you can appreciate here in this image, there are multiple raindrop lesions, like this raindrop lesions. Okay, and this is a classical finding seen in the gutted psoriasis. And this question, image based question, was asked in the June 2022. Okay, so psoriasis से हर साल एक questions तो पक्का है. So look at these points, then you're done with one question. Okay, moving on to the next question. Next image. Okay, so these images are related to the lichen planus. As you can appreciate here, the nail finding, this is called as a pterium. And the rash seen in the lichen planus, it is purple, plain, and it will be pruritic. And another classical finding of lichen planus is this white lacy pattern seen in the mouth. As you can appreciate here, white lacy pattern or reticular pattern. Okay, this is a classical finding of the lichen planus. So this was asked as an image based question, and this was asked as an image based question. Okay, so lichen planus also a very important topic. Then let's see few other important images, like this image. As you can appreciate here, it is due to the zinc deficiency, acrodermatitis enteropathica. So there is dermatitis, involvement of the genital area, and here also there is dermatitis. Okay, so dermatitis enteropathica, very important topic, and usually image based questions are asked along with relation to the biochem. ठीक है, तो ये एक वाइड टॉपिक है जो बहुत सारे सब्जेक्ट में कवर होता है, जैसे बायोकेम, पीएसएम, अभिडर्मा में भी हो गया, ठीक है, पीडियाट्रिक्स में भी हो सकता है. सो एक्रोडर्मेटाइटिस एंट्रोपैथी अ मस्ट डू टॉपिक. देन लेट्स सी अनदर इंपॉर्टेंट इमेज, अ 5-star इमेज, कोंडाइलोमा अक्यूमिनेटा कॉज्ड बाय HPV 6 and 11. ठीक है, तो ये जेनाइटल वॉर्ड्स, एज यू कैन अप्रिशिएट हियर, वॉर्ड्स है जेनाइटल वॉर्ड्स, मेल में भी हो सकते हैं, फीमेल में भी हो सकते हैं, एंड मोस्टली फीमेल की इमेज दी जाती है इसमें. तो गायनोकोलॉजी के पॉइंट ऑफ व्यू से भी ये बहुत इंपॉर्टेंट है इमेज. देन नेक्स्ट इमेज, पर्ली पिनाइल पेप्यूल. यहाँ पर अप्रिशिएट कर सकते हो तुम द वाइट पर्ली पेप्यूल लाइक लीजन्स. ठीक है, दिस पर्ली वाइट पेप्यूल लीजन्स, दिस इज ठीक है. देन मूविंग ऑन, लेट्स सी सम अदर फ्यू इंपॉर्टेंट इमेजेस. तो इस इमेज में यू कैन अप्रिशिएट दैट देयर इज स्पेगेटी इन अ मीट बॉल अपीयरेंस. ठीक है, and this is classical findings seen with the pityriasis vesicolor, and the causative organism is the Malassezia fulful. A very very important topic. ठीक है, ये माइक्रो के रिलेशन में भी पूछा गया है. ओके, सो स्पेगेटी इन मीट बॉल अपीयरेंस, जब भी ये फाइंडिंग दी जाएगी, यू शुड बी श्योर दैट दे आर स्पीकिंग अबाउट पिट्रियासिस वेसिकुलर एंड मलेशिया फुलफुल. इन दोनों में से कोई भी एक ऑप्शन में रहेगा. देन इस इमेज में यू कैन अप्रिशिएट पिट्रियासिस वेसिकुलर एज देयर हाइपोपिगमेंटेड लीजन्स प्रेजेंट. ओके, सो फाइंडिंग सीन इन द वेसिकुलर. इसके अलावा पिट्रियासिस की और भी दूसरे फाइंडिंग्स है, जैसे कि रोजिए, जिसमें हेराल्ड पैच दिखता है. ठीक है, फिर पिट्रियासिस अल्वा, इसमें एक्जिमा दिखता है. ठीक है, so these were a few other important topics related to the pityriasis. So moving on to another very important image, that is malignant melanoma. ये भी एक बहुत ज़्यादा important image है, सर्जरी में पूछे गए इन रिलेशन विद द सर्जरी, मेडिसिन, Okay, so how will you identify that it is malignant melanoma? Here you can appreciate the borders are irregular. Okay, and there will be history ki there is sudden increase in the size, and you can also appreciate that the color variations in the color, that here it is dark, here a little bit light, and here a different color. So these findings suggest that it is a malignant melanoma. Okay, so these were some important image based questions which were asked in the dermatology. I hope this video will help you in your revisions. Thank you for watching this video, guys. Like the video, subscribe to GrowMed, and share this video with your friends. Bye bye. Thank you.